I'm joined this morning, as always, I'm with producer Pete Cole. So good morning again, Pete.
Good morning.
And I am now joined by Dr. Stephen Poole. Do I have that right? It's Dr. Poole who's here with me, right?
Correct.
Because we will also be joined by Dr. Stephen Klein in a little while. But he had sort of a patient. Was it an emergency or just a
call-in?
A call-in.
I think so. I think an emergency.
All right. So he will be here. He'll be joining us shortly. So we're here this morning with Dr. Poole, who is pediatric radiologist, and you're on the board of directors for Jefferson Radiology.
Correct.
Okay. So my first question, I'm abandoning all the questions that I've written down, but my first question is, how is Jefferson Radiology affiliated or associated with Noble Hospital?
Jefferson Radiology for several years has provided radiology services to Noble Hospital. We're the radiologists that are there. We're the radiologists that the patients see each day and with whom the surgeons, the pediatricians, the internists interact every day.
Okay, so now where is Jefferson Radiology located?
Jefferson Radiology originated in Hartford, but we're all over. We're a group of 60 subspecialist radiologists who provide services at some Jefferson Radiology offices in Connecticut, and Noble Hospital was our first foray into Western Massachusetts. And the great thing is that we have people that are local to the area staffing at Noble.
Okay.
I myself lived in Longmeadow for several years. Dr. Klein lives in East Hampton. We have folks that live in Southwick. So folks that are local to the area, that are part of Jefferson, that are staffing and are part of the Noble community.
So now when you go to work every morning, Dr. Poole, where do you go? Do you go to Noble? Do you go to an office in Jefferson? I'm a little confused because I know that radiologists, you don't have to necessarily be right there to read whatever you're going to read, right?
Correct. And so Dr. Klein is at Noble 4 to 5 days a week.
Okay.
Many times I'm at the Children's Hospital in Hartford. I've also in the past worked at a Bay State Children's Hospital. Okay. And I'm occasionally at Noble. Because in addition to pediatric radiology, I do mammography. So women's and children's imaging are my areas. But you touch upon one of the important aspects of what we provide is the ability to have different subspecialists take a review of any exam from wherever they are.
Right.
So it's kind of exciting. We may have someone from Noble who has to emergently be sent to some other hospital. Or vice versa. And we're able to review the images. As well, we're able to have the experts in certain areas look at it from wherever they are. So we actually have someone who's a specialist in just head and neck imaging. And he could be somewhere else and be able to look at the images at Noble from wherever he is. So be able to provide the subspecialty expertise to the folks, to the patients, wherever he is.
And I think, just for our listeners, and we have a fairly large group of listeners who are older adults.
Yep.
And so I think for them, gone are the days where you actually have to physically carry a picture of an X-ray. Because I think that's what a lot of us who, I remember that even as a kid where, if somebody was going to read an X-ray, you actually had to physically have this whatever, the X-ray in your hand. But now everything's done digitally and through computers. And so that's why you've got this, you have the mobility issue. You can read it from across the country, probably across the world if you had to.
Absolutely. Yeah. And one of the exciting things about radiology is that, a lot of people don't know who radiologists are. Are we the folks?
That is correct.
Are we the folks that are taking the images? Are we the folks, what are we doing? And radiologists are doctors, just as internists or surgeons or pediatricians are doctors. And kind of the neat thing is, my mother actually was a secretary to a radiologist growing up and kept saying, Stephen, this is the perfect thing for you. It's the mix of technology, being a consultant, working in the dark. Yeah, she I don't know if she had a very high view of me. But,
there you go. My question was going to be, so why did Mom think this would be the perfect job for you?
It's a terrific job because there's a lot of technology and there's a lot of obviously science involved,
sure.
Anatomy and working with others. So who are radiologists? Radiologists are doctors, just like internists, pediatricians, surgeons. But what she would say, and some of the other radiologists that I talk with growing up, is the radiologists are the doctor's doctor. So when your doctor has a question about what to do, she may call me and say, "Gosh, I've got this patient. This is what's going on. What do you think I should do to evaluate it?" And I get that more from pediatricians than from any other doctors.
Okay.
And I think that pediatricians particularly are interested in making sure that the radiation dose is controlled, that the correct exam is done. So we'll get calls saying, should I do a CAT scan? Should I do an MRI? Should I do an ultrasound?
So you're actually getting calls before the procedure is done?
Many times.
Okay.
Many times it may be just routine.
Yep.
I have a patient with a cough. I'm concerned she might have pneumonia. Let's get a chest x-ray. Other times it may be more complicated. And so we'll have phone calls. We'll have conferences, meeting with all the other physicians. So frequently the radiologist will be radiologists are best thought as physician consultants.
Okay.
What exam should we get? And then, of course, there's the interpretation of that exam.
Right, which is kind of huge. So I want to come back to that, but before we do that, let's because you mentioned Mom, so
Yes.
let's talk a little bit about your background, Dr. Poole. So where are you originally from? Where did you get your training? Where did you go to med school?
I'm a Massachusetts native, but grew up in Connecticut.
Okay.
I went to Duke University, the home of the current national champions in
Yes.
basketball. In case anyone is unaware, I'm not sure.
Thanks so much to Duke because we had Dr. Brian Sutton on here back during the the road to the Final Four, so we had to go through the whole bracketology thing.
That's right.
Well, Brian was already out by like the second week. By the time do you remember that, Pete? Were you here when Dr. Sutton was
Yes.
here? We were doing the bracketology.
Yep.
Well, I, on the other hand, made it all the way to the end.
And
I
you
had
picked Kentucky.
no,
Okay.
no. I went all the way to the end. I had Wisconsin Duke.
Really?
Yes, but I had Wisconsin winning it.
Wow.
And my pool was winner take all. So although I came in second, I got 0.
I can't believe anyone would.
So
beat
thanks so
you.
much,
That's pretty
Duke.
good. Yeah.
Anyway,
Well.
that's my bracketology thing. But okay, so I digress.
So you went to Duke. I went to Duke and studied biomedical and electrical engineering, and I was very proud to take my my daughter there and to a college interview for the first time, and she said she wants to be an engineer. So I'm very proud. Went to University of North Carolina for medical school.
Now, was that in Charlotte? Or?
Chapel Hill.
Chapel Hill, okay.
And then to Boston for training in pediatrics at Mass General, a radiology at Beth Israel, and pediatric radiology at Boston Children's.
Wonderful. So
Yeah.
you've had some really great experience.
Yeah.
So and it sounds like you should be about 80 years old after all this training, but you look far younger than that.
Well, thank you.
You did a lot in a condensed period of time. And so now somewhere along the line in med school, you had to decide that radiology was what you wanted to do. Is that correct? Or had you decided that beforehand?
Absolutely. I actually was toying with a number of different things. Surgery, pediatrics, and I found that radiology it's a very diverse field. So you could have people that are interested in women's imaging, people that are interested in surgery, people that are interested in pediatrics, and it's because we interact with all the different areas in medicine. It's all within radiology. So
do you actually almost sort of subspecialize within radiology?
Absolutely.
That's
and
amazing.
so I'm a pediatric radiologist, pediatric radiology and mammography, and the reason is. I enjoy working with children. I enjoy being juvenile and playing around. But more than anything, I respect and adore and admire pediatricians. I don't know that I ever could be one. But the exciting thing is I get to deal with them on a regular basis.
And how much interaction do you have, Dr. Poole, actually with the patients? With do you?
Well, that's it varies. It varies, and that's again that there's a great diversity in radiology. You could be, as you said before, you could be sitting in a room in Australia and just reading images off a screen for 8 or 9 hours. You could be a breast imager and women's imager and perform biopsies, as I will be doing later on this morning. So obviously interacting with the patients. Being a pediatric radiologist, you meet with the children sometimes to do some specialized exams, or you could do something that is even closer to surgery, being an interventional radiologist, much like Dr. Klein does.
Okay. So, and there's our connector, because
That's
we have
a nice
now
segue.
been,
Nice segue.
we've
Yeah,
now been
nice.
joined by
that?
Dr. Stephen Klein. So welcome, Dr. Klein.
Thank you. Sorry for being late there. I had to deal with an emergency at Noble Hospital.
No worries.
We
We understand how these
understood
things
that.
go.
Yeah, exactly.
I got more time without you, undivided time.
Well, that was great.
I understand what it's like to being on call 24/7 because I'm on call to the police department, so I get that part of it.
Absolutely. So we're kind of talking all things radiology this morning. Yep, and all you have to do is make sure you talk right into the mic so that our listeners can hear you. So, Dr. Klein, why don't we start with something just really kind of very simple? Let's talk a little bit about where you're from, where you got your training, how did you get into radiology? So just a little bit about you.
Okay, well, basically, I'm from New York originally. Was an engineer. Went to school for 5 years for a engineering degree in electrical engineering. Then actually took a job working for GE at the Knowles Atomic Power Lab, working for the Nuclear Navy. During that time period, I realized that I really wanted to work to help people and to deal with people in that way. I'd had some experiences when I was younger on ambulance corps, and realized that I actually enjoyed doing that to a large degree. So wanted to go into medicine at that point. So went to medical school down in the Bronx at Albert Einstein, as you can tell from my accent.
No, not at all. You have an accent? I didn't notice.
So after doing that, I realized that I really enjoyed doing interventional radiology and having that person-to-person contact. And so did my training at Jefferson College in Philadelphia.
Okay.
And then from that time in, came to the Springfield area.
Now, are you from this area originally, or
No.
not originally?
No, not
Okay,
originally.
not originally.
I actually joined a different radiology group from Bay State and worked there for 19 years. Started really being the chief interventionalist at Mercy Hospital when we were covering both hospitals, and really enjoyed working in these smaller type community hospitals.
Okay, yep.
At that point.
Now,
We get a lot of that at Noble, believe it or not. A lot of the guests they come from, we had Dr. Schmelkin came from
Yeah.
a Long Island group
Yep.
that was huge,
Yep.
huge medical group, and he just loved it here.
Yep. Had a summer home, and his family had a summer home in the Berkshires,
yep.
and he had been coming up here for years. You mentioned the word, and you've used it twice now in the last 2 minutes, interventionalist. Is that, what is, define that? How are you using that?
Okay. Basically, interventional radiologist is someone who uses the imaging from radiology to perform procedures such as what they call angiography, where you're looking at the arteries and veins of the system. And you can do all kinds of procedures that way. As far as if there's a blockage in a vessel, you can put a stent in to help open it up. If there are clots present, you can give medication to help dissolve the clots. We also do all kinds of procedures that if there's an abscess in the body somewhere, we can use imaging to put a catheter in that area and to drain it.
Is that something that's attached to the actual tube that houses the imaging sensor?
Well, the imaging, we use all kinds of imaging to perform it. We can use ultrasound for doing our procedures. We can use regular X-ray or fluoroscopy to do procedures. We can use CT scanning to do those procedures. Basically, it's any type of imaging where you can look at what you're trying to target.
Okay. Did the engineering help you? Did it give you a little leg up going for radiology?
Actually, I think it has. And the computer work, doing when you take images and you do 3D reconstructions so that it looks almost like a 3D person in front of you.
Like a model.
Like a real model
of just a picture, yeah.
So I think that has helped.
I would think it would give you a little bit more background knowledge when you know the workings of the machine to a certain extent. It gives you more the limitations of the machine.
This is true. It also makes someone concrete in thought and easier to do these procedures.
Well, it's interesting, Pete, that you asked that question. I was thinking the exact same thing because, Dr. Poole, you also mentioned, had you initially started out as looking into engineering, or that was something you were considering? Or
biomedical and electrical engineering.
Yeah, exactly.
I worked for a short period of time for an engineering firm in Japan. And one of the other aspects that I kind of wanted to bring up that is associated with kind of the more scientific aspects of what we do is radiation. And one of the things that as a pediatric radiologist that I'm very proud of is the way that we try to determine the appropriate exam based upon limiting the amount of radiation. Children are more sensitive to radiation because of their growing body and dividing cells and things like that.
Sure.
And radiology is very, very safe. The exams that we have are oftentimes have less ionizing radiation than folks experience just backgrounds in their lives. The largest source of radiation that most people will experience.
Ooh, I know the answer to this one.
Is
the big ball in the sky.
No.
It's not the sun?
No, it's not. It's
okay,
actually...
You failed on that trivia question.
Over one. You will come up with another question for you later, maybe.
All right.
But it's radon. So that's why, particularly in this area and many areas, before you buy a house, folks
they have to
recommend...
do a radon test.
Exactly, getting a radon test.
But I don't exactly, when we did that, when we bought and sold our homes and so forth, but I still don't exactly know. What is that? Like, where is radon?
Radon is a gas that seeps up from the ground. Okay. And it's interesting because you'll get a radon. There are certain areas in the country that have higher degrees of radon.
But that's what I was going to ask.
But it's so specific that it may vary from house to house.
Okay.
And it's a relatively small amount. But some folks may have a larger amount. But the ionizing radiation associated with a chest X-ray or a mammogram or something like that is much, much less than the radiation that you're going to get in a year just from background radiation,
just from living in your home.
Exactly, and just breathing in the air. As well, if you're if you're maybe I should give you a partial credit because if you're a pilot, you're closer to cosmic radiation. You're closer to the sun.
Okay.
And you're going to get more radiation. So if you were to fly from here to California, you would get the equivalent of a couple of chest X-rays worth of radiation simply by being closer to the sun.
With less protection from the atmosphere.
Exactly. So I think it's important for folks not to be, when they hear about radiology, not to be scared about it, because many of our modalities have no ionization radiation at all, such as ultrasounds or MRI. As well, those that have ionizing radiation often have a very, very low amount. Such as a chest X-ray or a mammogram.
Now, I want to ask you something. I just want to jump in. Is that different than sort of in the old days? I mean, has that changed over time? When you got an X-ray, say in the 1960s or the 1970s.
Absolutely. And there's there have been studies from the 1940s for girls that had scoliosis at that time.
Yes.
And the incidence of breast cancer from the 40s was actually higher than baseline from those girls that are women now that got scoliosis films. Okay. That is a world of difference. It is as different from black and white TV to streaming streaming content over your streaming HD content. Yeah. The radiation dose with a scoliosis film now is a tiny, tiny fraction, less than 1/100th of what it was in the 1940s. So for So certainly that's something to consider, and you don't want to.
It is, and I think, but one of the issues, again, we have a lot of our listeners are older adults, and I think have a recollection of that with when the doctor says, well, we're going to take a chest X-ray. I can remember my mother. Don't take another chest X-ray. I don't want I'm sure it's fine. It's an unnecessary procedure, even if it was necessary.
Right. And so if you
because of that fear of overexposure,
exactly. And so if someone were to have a CAT scan, which is a higher degree of radiation day after day after day, that obviously is an issue. But the decision, you can kind of think of it logically. The decision to not have your yearly mammogram, and breast cancer being perhaps the second highest cancer killer of women, not having that mammogram. If you want a trip to Hawaii, would you not take it because you're scared of the ionizing radiation from being? Of course not.
Yeah,
if your child were going to go play down the street at a friend's house, would you ask for the radon testing of their house before you let the child go? Of course not, because it's a very, very, very small amount. So one of the things that I'd like to get across to people is that the radiologist, we're not just the folks that are reading the exams. We're the ones that are helping to determine what the appropriate exam is, consulting with your doctor to make sure whether it's an older patient getting a mammogram or a young patient trying to determine can we do an ultrasound, which has no ionizing radiation, versus a CAT scan. We're the ones that are helping to determine how best to get the answer that your doctor needs with the lowest amount of radiation. As well, when those exams are done, one of the great things about having such a large, diverse group covering at Noble is that we review the technical specifics of the CAT scan machine before the exam's done. So how can we alter the exam to lower the dose even more? So I think that folks that are coming to Noble can be very, very confident when their doctor sends them for an exam, whether it's a CAT scan, a mammogram, or an X-ray, that they're getting the right exam, and that there are folks that are there that are checking to make sure it's the right exam. It's not just that you're picking up groceries and someone's mindlessly putting them in a bag. There are folks that are looking at this, making sure it's the right thing, and then of course there's the aspect of the interpretation, and if there are any subspecialty issues. So if you need a neuroradiologist or a pediatric radiologist or an interventional radiologist, we have those folks to review the exams.
So those are folks that would be available through Jefferson Radiology.
Absolutely, and many times at Noble.
At Noble Hospital.
And so we have Dr. Klein is going to be taking care of interventional procedures today, and I'll be taking care of interpretation of mammograms and performing breast biopsies. Okay,
and Dr. Klein, I want to bring you in because I have a question, which is, and again, I always try to think about this from the listener's point of view. So we have sort of average Joe six-pack out there listening to the show. What is the difference between a CAT scan and an MRI?
Well, the CAT scan is using ionizing radiation, or like X-rays happened in the past, whereas the magnetic resonance imaging is using magnetic, you can call it magnetic radiation, but it's basically like a large magnetic field that you go in.
And why would a doctor or a radiologist who's ever making that determination decide on one versus the other? When would you use a CAT scan, or is that sort of is that kind of dying now, or in favor of MRI, or
no?
Not really.
Each modality is better at looking at different parts of the body and at looking at different types of abnormalities. So there is a place for CT scanning and there's a place for MRI.
Okay. Can you give us a couple of examples, maybe?
Well, just for me as an interventional radiologist, when you're looking for an abscess to drain, or you're looking for other abnormalities where you're going to be doing interventions on a person, a lot of times CT is going to be much easier to image things and to follow placing a catheter in. Okay. Whereas with MRI, you're limited as far as the devices that you can use, because with the high magnetic fields that are there, you can't use certain types of metals or other materials to do your procedure.
Okay, understood. Yeah. Okay. That makes sense. It is 7:42. You're listening to WSKB 89.5 FM radio for the Westfield masses. My guests this morning are Dr. Stephen Klein and Dr. Stephen Poole. Thank you for both having the same first name because that made things really simple for me. Radiologists with Noble Hospital and Jefferson Radiology. We're going to take a short break, and when we come back, we'll talk some more radiology. But anyway, I have two fabulous guests on this morning, Dr. Stephen Poole and Dr. Stephen Klein.
We promise not to go on Patrick's show. That
Thank
makes
you.
You feel any better.
Okay, Patrick, and I know Patrick's listening, so there you go, Patrick. We got you.
Unless you have a better offer, Patrick, just let us know.
Yeah, Patrick pays better. He feeds you. That's the thing. See, right? He can feed you, and I can't do that here. But anyway, Drs. Klein and Poole are radiologists with Noble Hospital and with Jefferson Radiology. We talked a little bit about Jefferson. So how many? Well, first of all, is Jefferson East Coast, Northeast, national? Like how big is this organization?
We're Connecticut and Western Mass.
Okay, Connecticut and Western Mass.
And we're seeking to just provide the best service we can to our patients at our offices and at the hospitals.
So what happens is Noble Hospital contracts out with Jefferson Radiology? Is that how that works?
Yeah, but what Noble does is it has us serve as the radiologist on site.
Okay,
so
perfect.
It's as though we're as part of the community at Noble as any of the surgeons, the internists, the pediatricians, the folks. While we do have some folks that rotate in and out, folks like Dr. Klein are there 4 to 5 days a week. So it's the nice thing is though, while we have the support of the Jefferson enterprise.
Yep.
The folks that are at Noble will see Dr. Klein on a daily basis. But when you have that case that requires some expertise, if there's a complicated head and neck case or there's a complicated interventional or breast case, it is, as you said before, it's instantaneous that we're able to get.
You can call in the troops.
Exactly, and
Jefferson.
so it's as though
absolutely.
as though everyone from our enterprise is at Noble providing services.
Now, we've talked a little bit about the subspecialties, and what is it that's different between what the two of you do? Because you do different. You're both radiologists, but clearly you're doing different types of.
And it's almost to the degree of the difference between a pediatrician and a cardiologist or a surgeon. There are certain things that we can do that might overlap, but we really I think gain a lot of experience and expertise by doing just certain things all the time.
Okay.
Sure. My wife was we were at a bike race the other day, and a child fell down and. I wasn't there, and someone said, "Oh, why? Dr. Poole, wish he were here." Well, there was a
you said, "I don't know how to do first aid. I'm a radiologist.
I'm a doctor, but I'm a radiologist." And there was a PA who works in an emergency room that was there. It's like, whether it's if you're a PA or you're a nurse, you do something on a regular basis, you become an expert in that.
Absolutely.
And so that's the thing is we're just trained to look at our particular area, and there's certainly overlap. But if there is, there are risks to any surgery.
Sure.
And by performing interventional radiology, it's much easier. It's you can just place in and just have like a tiny little
you give the surgeons a roadmap.
Exactly. Well, yeah, and what you can do with this. So I don't do that. That's something that Dr. Klein does. And so while we're both radiologists, if someone says, "Gosh, I want you to put in a catheter and take all that gunk out of the patient's belly," I would just hand the.
You would just pass.
I would pass over to my good friends.
You would say, "I'm going to punt on that one."
Right. What's happened over time is that you try to minimize the risk and of doing these procedures, and there's a lot of things previously that only could be done by surgery that are now being able to be done by radiologists and interventional radiologists, and the difference, you have to understand that we've both trained as radiologists, so we all have that basic training.
Right. You have the foundation.
Right, and then we go ahead and do our subspecialty on top of that. So that's how we can continue to do what we do at the higher levels.
So, Dr. Klein, let me ask you this: what do you think is the most challenging thing that you come up against in your work within the field of radiology?
Well, there's certain issues as far as competition between radiologists and surgeons and cardiologists for doing certain procedures.
Oh, yep, that makes sense. I can see that.
The hardest thing you run into is staying up on your field of expertise, and it's a ever-changing and ever-growing field, and that's why you have to keep going on with the education, and education never stops.
Yeah, absolutely. And I'm going to throw that question out to you, Dr. Poole. What do you think is the most challenging thing about, what's the biggest challenge, I guess, that you face within your field of radiology?
One of the things that I try to do is communicate with the pediatricians. As I said, the reason that I love pediatric radiology is not as much the kids as it is the pediatricians. And one of the challenges that I face is trying to be as in close contact with the pediatricians and or the internists or the surgeons, and making sure that I know what it is that they want. So what we have a very nice system set up such that if we need to get someone on the phone, we can get them on immediately. So one of the challenges I have is I always want to find out more about why this exam is being done. So it might say pain. I'm like, yeah, but gosh, is it pain on the left foot? Is it pain on the medial or lateral aspect or this or that? So I would say I strive to have greater communication and with the referring physicians and with the patients themselves. So it's not really it's something that we strive to. I just wish we had more time for that. And
I guess that would be my follow-up question, which is how difficult or easy is that to?
It's with our enterprise, it's so much easier. We have a very sophisticated computer system where I will send a note to one of our assistants and say, could you please get Dr. Smith on the phone? I'll go take care of something else. 5 minutes later, Dr. Smith's on the phone for me.
And then you can ask those specific questions about a case that you're...
Absolutely. And the other issue also about staying up on things, it is, I try to make it a habit to do my homework with my kids. So they'll be amazed that I'll say, "Oh, I've got to read this article," and they're like, "But Dad, you're like 800 years old,
right?
Like,
You already finished school.
Oh my God!
How old are your children?
15, 12, and 7.
Oh yeah.
And so I've always sitting down, making sure that they did their homework, and then do my reading. And they're a little bit disappointed that once you finish college or graduate school or whatever, there's still homework.
There's still learning to be done.
Stop.
But you know what? I think medicine especially, it's just one of those, as Dr. Klein said, it's just an ever-changing field. And you just have to keep up with whatever the newest and latest. And it's not just, it's the technology and it's the information that we know, but then it's all that other stuff like insurance coverage and, all of those HIPAA rules and, all of that unfortunately, it falls back on the docs as well. You kind of have to know about a lot of things.
We do.
Yeah.
Yeah. And one other thing about the communication, it's much easier at the community hospitals. It's more of a family feel. So between the techs, the doctors, the administration, and the patients, the communication is much easier to do. And it's more of a family. People care about each other, and that's something you get at the community hospitals that you don't get to a large degree at the large medical centers.
Yeah, we've actually heard that. I think Pete and I have heard that a lot, haven't we, Pete?
That's been a recurring theme.
It has been a recurring theme.
Amongst all the guests from Noble.
Exactly. And one of the things that I think attracted some of the doctors to Noble Hospital, because it is a community hospital, and as Pete said, some of them have come from much larger medical centers. And again, there are pros and cons on both sides. And certainly those larger medical centers definitely have their place. I mean, I know I run the senior center here for the city of Westfield, and I know that, my older adults like to know their doctors, they like to feel comfortable with their doctors, as well as their nurses and their PAs. Now I think more and more PAs have a place in all of this, and so now I'm hearing from, my seniors that they're getting to know them as well. They know them by name, they do, they're participating in the visit, and I think that's really important. So, that's how I feel. It's a little bit of a drive for me to come here, but I always treasure my days at Noble because of the experience, because of working with Dr. Klein, and they've got a very nice cafeteria as well. They do.
They really do. It's just fantastic.
Well, we've had the dietitian. Yeah, dietitians on here. We've had a whole host of people from Noble on here, and
their yogurt parfaits are
just really good. So we're going to have to get Allison Mitchell, the dietitian over at Noble, back here to talk, because we talked about the food that was offered in the cafeteria.
Good. Yeah,
and it was interesting because when we first started the radio programming, and we decided that we would have Noble represented pretty much on a weekly basis. I told Allison Khalil, I said, I don't just want a string of doctors coming in. I want, mix them up with
chef.
Right. And just, some of the other disciplines. So we really have had, boy, you name it. I mean, we've had the chaplain on, we've had dietitian on, we've had the volunteer coordinator on, I'd like to get some of the people that run some of the support groups, but we had the Joe Baraka, who is in charge of a smoking cessation program. So it's really been kind of nice. So I think people are really getting a better feel for all that Noble has to offer, even though it is, it's a small community hospital, but they do a lot. So it is 8:02. We are out of time. I would like to thank my guests, Dr. Stephen Poole and Dr. Stephen Klein from Noble Hospital and Jefferson Radiology. Thank you for enlightening us on what radiologists do, because to us, you're just the guys in the back with the glasses looking at all these films. And
we're people too.
You are people too. So thanks so much. Have a great week. Mayor Dan is here. Yes? Is it yes?